Before you begin prepping, it's a good idea to lay out drop cloths on either side of the patient's abdomen to collect any pooled solutions, which could irritate the patient's skin. Ensure adequate exposure of the surgical site, and then remove your non-sterile gloves. Before prepping, it is recommended that you perform hand hygiene, either with soap and water or a hand rub. If you are unfamiliar with a prep solution, familiarize yourself with the manufacturer's instructions. We will be using ChlorPrep. Open the prep stick in a sterile fashion, and then don your sterile gloves. Once you've donned your sterile gloves, grab the prep stick and the cotton tip applicators from the prep packaging. To use the prep stick, compress the tab on the side of the stick. You will see the sponge start to turn orange as the solution comes out. Get some of the solution on one of the cotton tip applicators to clean the patient's umbilicus. Use both cotton tip applicators. Sometimes you'll need more than two to adequately clean the patient's umbilicus. Now, using the prep stick, start at the incision site and work your way out, using back and forth strokes to prep the entire surgical area for 30 seconds. Never go from contaminated areas to clean areas. When you're complete, remove the drop cloths and ensure that you wait an adequate amount of time for the prep solution to dry. ChlorPrep requires 3 minutes to dry on hairless skin. For skin with hair, it may take up to an hour to dry. When using a prep solution, you will need a prep kit, sterile gloves, and the prep itself. In this case, we'll be using chlorhexidine gluconate. After opening your prep kit in a sterile fashion, be sure to refamiliarize yourself with the prep solution's manufacturer's instructions. After ensuring that the prep has not expired, pour it into the prep kit. After performing hand hygiene, you can don your sterile gloves and prepare to prep the patient. Ensure that the sponges that come in the prep kit are adequately saturated with the prep solution. Then, starting at the incision site, work in concentric circles or back and forth motions to adequately scrub the surgical site. This prep should take about 2 minutes to complete. With the help of your scrub person, you will drape the patient. Here, we will use 4 towels to square out the surgical site. Be sure not to get too close to the patient with your gown to touch any parts that aren't draped. And always go from prepped area to non-prepped area. Never go from non-prepped area to a prepped area. You can keep the towels in place with towel clamps, staples, or the sticky part of the drape itself. Take the drape, place it directly over the surgical site. With the help of your scrub person, ensure you protect your hands so that your sterile hands don't touch the non-sterile part of the patient. Go from surgical site to bottom and surgical site up top, where the anesthesia provider will secure the drape to the IV poles.